Imagine you have a heart attack, head to a hospital for emergency surgery, and wind up with a bill of more than $100,000.
That's what a man from Austin has been dealing with for the past 16 months. KXAN's Alyssa Gord explains why he was left with the six-figure bill.
I've had this bill is it's just as bad as the heart attack.
An Ironman triathlete, dad, and teacher, Drew Calver was shocked to wind up with a heart attack in April of last year. A neighbor drove him to St. David's Medical Center because it was just blocks from their home.
And they said, yeah, we've accepted your insurance.
It came out to about $165,000. His insurance as a teacher at Austin Independent School District covered around $56,000. That left Calver with a bill just shy of $109,000, about double his annual salary.
They never worked with us or offered to work with us until August. So until then, all we would get would be phone calls saying, you owe us $108,000. Would you like to pay it in one payment or two payments?
They say this summer they were told they'd have to foot the whole bill, and collectors began calling.
I need to focus on staying healthy and prevent another heart attack. This is doing the exact opposite.
St. David says they did everything right in this situation. Calver's insurance just has a narrow network, and he got a large chunk of the bill because their hospital was not in network. St. David's also estimates that if Calver applies for financial assistance, his bill could be reduced to less than $800. But the Calvers say it's the first they've heard of that number.
I think it's important that people realize that even with insurance, doesn't mean you're covered.
Alyssa Gord, KXAN News.
Aetna, who covers Calver's health care plan, explained they only administer claims for AISD who is self-insured. AISD tells us that they provide plans to more than 11,000 employees, but they say that the ability to offer low-cost coverage and a variety of options is becoming increasingly difficult as healthcare costs rise. And if you get a surprise medical bill, it's likely because your doctor or provider wasn't in your health plan's network. According to the Texas Medical Association, insurance companies save money by severely limiting which doctors and hospitals they include in their networks. They call them narrow networks. Insurers are using them more and more, especially in Texas. The TMA is calling for more transparency in this area, saying insurance plans need to have more hospitals, doctors, and lab services in network. That way, patients have less of a chance of stumbling into an out-of-network care situation.